Hi everybody, Dr. Julie Lachman here. Today I'm excited to talk to you about cease therapy. I have a lot of calls for cease therapy that people have heard about from patients of mine or on the internet. So we're going to talk a little bit about what it is and explain it. So cease therapy is an acronym. It stands for Complete Elimination of Autism Syndrome Expression, but it can be used for things that aren't autism, which is very exciting. Cease therapy was developed by Dr. Tynes Smits. He's a medical doctor from Europe. Unfortunately, he did pass away a few years ago, but he's left us with a wonderful legacy and 2 books. This is the first one, Autism Beyond Despair. You can buy it online, and I highly recommend it. And here's a characteristic child, very sensitive to noises and in his own bubble. And what we see with cease therapy, naturopathic medicine, wonderful supplements, and great parenting and diet is that we can slowly, not pop the bubble all at once, but we can slowly dissolve it, which is really cool. So before I talk about cease therapy, I need to talk about homeopathy and isopathy. So homeopathy has been in use for over 200 years, brought to America by Samuel Hahnemann, a medical doctor from Germany. And homo, if you can guess what that means in Latin, means similar. So we have homophones, which are words that you learn about in high school grammar class. And these are words that sound similar but are not the same. So like two and two, there and there, these are words that are spelled differently and have completely different meanings. But they're similar. So homo means similar, and pathos means disease. So homeopathy is the practice of treating one disease by giving something similar. And isopathy is the practice of treating somebody with the exact same thing, maybe less of a dose, then that initially may have harmed them in the first place. So isopathy is the same treatment, and homeopathy is a similar treatment. So say you burn your hand on a hot stove, instead of putting it in cold water, don't do that. You should actually put it next to something hot, like next to the stove, but not burning your hand, or in warm water. And that would be homeopathy. It's a similar temperature. So with isopathy, they are the exact same thing. Homeopathy, we use homeopathic remedies made from plants, animals, minerals. And if you took too much of that plant in a bulk dose, you might actually get the symptoms that we're treating. So for example, I have a lovely aloe plant here that was given to me by someone locally. And so this aloe plant, if you took the aloe and you ate it, you would get diarrhea. No fun. But aloe homeopathically is actually a treatment for diarrhea. And we take aloe and make it very, very, very dilute. There's not even a molecule of the plant in there anymore. And that's going to be put on a pellet, although it doesn't have to be. You could actually take aloe and dilute it in water and make your own medicine that way. And that could treat diarrhea, even if your diarrhea was not caused by an overconsumption of aloe. So that's homeopathy. If you did actually poison yourself with aloe and get diarrhea, you could dilute the aloe, and that would be isopathy because you actually did poison yourself with too much aloe. So don't do that. We'll just keep it there in case some sunburn patient walks in. So isopathy is using the exact same thing. And Dr. Smits was treating a lot of kids with autism and having great success, but he also found that not everybody was improving as well as the other kids were. They were improving, and then they would plateau, they'd come to a wall, and they just couldn't break through. So let me read you a quick quote from Dr. Smits. This is from the Autism Beyond Despair book. Many homeopaths still believe that everything can be healed through homeopathy, classical homeopathy, in terms of the symptoms in this book that they're talking about, not everything in the whole world. But in my experience, classical homeopathy is not enough to cure autism. In my method of treatment, it is of first importance for the treating homeopath to see where to apply traditionally used homeopathy and where to use isopathy. So I use homeopathy with most of my patients, and especially with my autistic patients, or really anybody who comes in, we use homeopathy. But then I also add in isopathy, which is cease therapy, when we have a symptom that we can correlate to a specific toxic exposure. For example, I had a woman who got a scan with contrast, and this contrast was called gadolinium, which enables the radiologist to see more about what's going on in the body. And so with gadolinium, she developed a horrible rash. She broke out and her skin was horribly itchy. She tried a number of different homeopathic remedies and herbs, and they only helped a little bit. So what I did was I actually had her order gadolinium in a pellet, very, very, very dissolved, again, not even a milligram in there. And that became part of her plan, along with liver support and other things that we did. And I think that was really helpful for her. So that is isopathy, using the exact same thing to treat the symptoms that we have. Now, if I had someone with a skin rash that looked like the gadolinium rash, but the person didn't have a CT or contrast or anything, I could still use gadolinium for that. And that would be homeopathy because it's similar. So remember, isopathy is the same and homeopathy is the similar. So what Dr. Smits does is if we find somebody, whether it's autistic child or not, somebody who's had a reaction to a drug or any sort of chemical, we can actually use that in a very, very safe and dilute method as part of the treatment. So that's the difference between isopathy and homeopathy. And in future lectures, we'll talk about how we use that in specific cases. Bye for now.